Section
Yes,
52 explicitly states, a person shall not remove tissue from a living person for transplantation in another living person or carry out the transplantation of such tissue except in a hospital authorized for that purpose
Continue.
and on the written authority of the medical practitioner in charge of clinical services in that hospital or any other medical practitioner authorized by him or her. And then it also continues here, but I want to believe that you're referring to 52B subsection 1.
Yes, 52B does not ask for consent
From
of
the
patient.
individual.
No. So the doctor or the administrator can order the removal of an organ without your consent. So a Nigerian, and all Nigerians face this. Let me just tell you what.
Isn't that an oversight?
It's not an oversight. They go to section 49 and introduce what they are saying is consent. But that consent, the statutes of the law act independently. So you cannot use that consent in section 49 to justify section 52. It's not possible because 52 can be used the way it is.
So it's not an oversight, since it's clearly stated in section 49 that you only can do this, take the blood from the individual, from the person, with the person's consent. So if it's truly same, they should have also inserted it in section 52.
Absolutely. And they skipped that. And the reason for that is this. The world organ sources for transplantation has dried up because India shut down its doors and said nobody is going to come here from America. You know, the medical tourism you talk about. It's just that Indians made their organs available for the West. So people were going from the West to India to get organs they wouldn't have gotten in their own country for 20 years. That was what the genesis of the medical tourism in India. It was not that Indian medicine was that good, and it's not, even compared to Nigerian levels. Till date. What had happened was that the Indians allowed people to get transplanted organs in their country. The poor in India almost lost all their organs. Many of them lost their lives.
Wow.
So now they have brought this to Nigeria because the international sources for these organ transplantation have dried up. And they are now seeking to use Nigeria.
Do you think there's some sort of international pressure?
There is a lot of international pressure.
Which necessitated this bill?
Absolutely. There is a lot of international pressure. And we know that the Western countries have been pressurizing Nigeria. And you know, the overt one was, you know, of Western interference was David Cameron saying that we are going to link, if you don't allow abortions and all the other things, we are going to link it to foreign aid. But that was the overt one. But we know that they have been interfering. UN agencies have been playing a very negative role in this. Really? International donor organizations have been playing a very negative role in this. And they have been fostering and putting pressure and interfering with the legislative process.
Well,
this is a proxy war, the way we see it.
Oh, you say it's a war, sorry, Mark, and in our research we realized that you've written to some of these countries, the United States as well as the Nigerian president here on this particular matter. Did you get any response, especially from the health ministry, concerning some of these observations?
Yes, we have written extensively. We've written to all the G8 leaders. We have written to World Bank. We have written to the Nigerian president. We have written to the Senate president. We have written extensively on this. And we've gotten some responses on this issue. However, when you read the responses, you see evasiveness. They are evading the main issues we are talking about. You cannot take a whole nation. And it's not the poor only in Nigeria. It's everybody. Let me give you an example. Let's say the billionaire is in the US, needs a heart, and sends money, $10 million, to a Nigerian hospital which has been concessioned out to foreign investors. Now, the hospital will be run by, according to this bill, by some foreign investors who can also have only their own nationals working in that hospital in very, very sensitive areas because this bill authorizes it. So what will happen is that If, let's say, the tissue matches that of maybe then our Senate president, whoever that may be, of that billionaire who has paid $10 million, they will take the heart. It's not a question of they will take the heart of a keke driver or an Okada rider or a palm wine tapper. They will take the heart of that person who the tissue matches. So everybody in Nigeria is at risk. It's not just the poor. It's the legislators themselves. It's the president himself. Everybody is at risk.
You mentioned something. You talked about fertility clinics, IVF. You mentioned one in particular, Nordica, and how they're complicit in all of this, especially in the trafficking of human embryos. The thing is, IVF clinics were started as a good thing, and it seems they're beginning to gain ground here in Nigeria. Is it that they're doing something cynical, sinister behind the backs of their patients and their customers?
Yeah, if you look at what the European 2006 report by Tutkova investigating human embryo trafficking, human egg trafficking in Europe and across the world, it is very, very clear that the IVF clinics, some are implicated in human egg trafficking. It is very, very clear. And it's not just that they are implicated, they are also trying to get a legal framework that will make this legal, which will devastate the entire population.
But because currently there is no legislation concerning the setting up of IVF clinics and what they can do and what they cannot do, right?
Yes.
So it's not like as if this should ban them. I mean, wouldn't this bill, assuming the entire section 51 and 52 is expunged, doesn't it affect the good work that some of them are doing?
Yeah, what we are saying is life begins at conception. Now, if you're going to practice your IVF and respect the sanctity of life, then that's fine. But there has to be a bill for it. It's a separate bill. It's not a system regulation bill. They came up with a bill on reproductive health authority. What was it? It was just a bill to permit the same egg trafficking. So that was why, in the public hearing, Nigerians screamed and shut down that bill. So if they are going to be clear and we are going to go into a transparent process of actually enacting a bill that will make IVF possible within a legal framework, respecting the sanctity of life, then that will work.
Do you think this sections 51 and 52 can be rewarded in such a way that it does just that?
With a lot of difficulty. Because even though we can reward certain things and insert the personhood part of it, it still will lack the other aspects of the bill that will show how you do this. Because it's in a system regulation bill, you have to really show how this will be achieved. And you can't just do that in a small section. So it has to be a separate bill which will address this issue.